Hello everyone. From this video, we are going to study the diagnostic method inquiry. In our textbook, we place the inquiry at the beginning of the 4 diagnostic methods. So from here, we also can see that how important it is, inquiry. And for the study in diagnostics, what's important here the first is we need to understand the terms, the definition of certain medical terms that we are using, such as sweating. What kinds of symptom we call sweating? How many types of different sweating? Or even fever. What kinds of symptoms we consider as fever? How many different types of fever? And also, what are their manifestations? So the first is the definition and the manifestations we need to understand. We need to understand for certain medical terms we use in Chinese medicine and acupuncture. Also, secondly, we need to understand what's the cause of these symptoms, what's the cause of these manifestations, include the symptoms and signs. So that's the two aspects that we need to focus on in a diagnostic study. So firstly, we're going to talk about inquiry, and then what's the significance of inquiry, why we need to inquire, why we need to talk to the patient. That's because apart from the significance from the slides, because many diseases that we need to inquire, we need to ask from the patient, because although nowadays we got better and better the technique which you can examine the patient, such as the blood test or the other image examinations such as X-ray, CT, ultrasound, or MRI. So these techniques that we can use for diagnostic, but sometimes some symptoms, some conditions we still cannot see from the medical reports, such as headache. Can you see the headache? Can you see the headache from the medical reports? Can you see where does the patient feel? Which area does the patient feel the headache? Or how severe the patient can feel the headache? How severe the patient can feel the pain? So, especially for the pain, what kinds of feeling, such as distending feeling, or stabbing feeling, or hollowed feeling? So what kinds of feeling related to the pain? All this information we cannot see from the medical reports. That's the only way we get to know is to talk to the patient. The patient is the only one who can describe these kinds of information. So these are very important, and also from the discussion, from the conversation between the practitioner and the patient, we also can understand how does the disease onset, what's the development, is there any changes, are there any changes from the beginning until now when you see the patient. Also, what's the treatment the patient has accepted, because these information can help us to diagnose and also can help us to avoid some treatments that's not that effective. So all these informations only can be attained from in the discussion, from the conversation with the patient, and also some past disease history where the patient travels, such as the COVID-19. When we see a patient, we will ask, have you traveled to certain area or certain cities? These information only can be attained from the conversation. And also, where can we attempt the conversation? Where can we attempt the answers towards these questions? The most authentic answers will be attained from the patient directly. Only if the patient cannot describe or cannot communicate well, then we can discuss to a third party, such as the relatives, especially such as the kids. If the kids they cannot describe the symptoms or they cannot describe the discomfort properly, we can ask the parents, or some patients such as unconsciousness, coma. So these kinds of patients, we can ask the relatives. So from the inquiry, we can attempt many informations. We also can see the psychological condition of the patient, the emotion of the patient. That's why inquiry is very important in the diagnostics. So since the inquiry is so important, how can the conversation or how can the consultation carry on? The procedures of inquiry. What information needs to be included in a consultation? And how long does it take for a consultation? So let's answer the second question first. How long does it take for a consultation? There's actually no specific answer to this question. The consultation can take from a few minutes to half an hour or even longer, depends on the situation, on the patient's situation. And then what information needs to be included in a consultation? The information such as the general information, the chief complaint, the present disease history, the past disease history, the personal lifestyle and history, the family disease history, and so on. So these information we're going to discuss one by one, and these are all the contents that need to be included in a consultation. The method of inquiry, how to perform inquiry, asks in details about but concentrates on important related aspects. So the inquiry needs to be concentrates on the chief complaint. So we don't ask randomly. We don't ask random questions. But for random questions, sometimes also quotation marks there, because random questions sometimes also related to the disease, but just in general, your questions should related to the chief complaint, and we ask the questions from the chief complaint, and then we ask other questions to confirm your diagnosis or to identify the other disease, or we try to confirm that we can exclude the other diagnosis. And the second is analyze and diagnose when asking questions. So this process actually happens along the conversation. From the first question, and the patient answered. From the answer, we will ask the other question. So these are why we ask the second question. That's based on the answer from the patient. And then this information in our brain, in our mind, can reflect. In our mind, we actually keep analyzing what happened to the patient, what I need to know. So these are the practice you need to learn in this course. You need to learn this skill in the diagnostics of inquiry. From the inquiry, we need to ask for the results that we can help us to identify a disease or a pattern. So we're going to introduce in these few weeks how to inquire and what kind of symptoms can help us to identify certain patterns, or which manifestation is unique for a specific pattern that will help you a lot to identify certain disease. But before we go to the details, the last aspect is the cautionary notes in inquiry. So what need to be think about during the conversation. We need to have a quiet, undisturbed consultation environment. So these are actually not our responsibilities, but more from the facility, from the institute. So we need to have a proper consultation room that you can feel private inside. The patient can feel private inside. That's the only way that they can speak, they can talk to you freely, because they don't need to worry about if someone outside the room or next to them can hear the conversation, especially for some medical condition that's very privately, such as the medical condition related to menstruation, related to fertility, related to men's problems, or related to the pregnancy. So these are more private information that the patient, if you discuss it with the patient, they need to have more private environments that they can feel safe to talk. It will help you to improve the conversation. Otherwise, you won't be able to obtain the true answers from the patient. The second is to have a nice and responsive attitude. That's from practitioner. Our attitudes need to be responsible, need to be nice. So we should not, for instance, if you fight with your girlfriends or your boyfriends or your husband or wife at home, and then now you see a patient in half an hour, but you were so angry. So when the patient comes, you shout at the patient. This will not help you in a consultation, because that's your attitude. So what the patient will affect what the patient tell you and how the patient can rely on you. So during a consultation, we need to be nice and responsible. Also the language, the words we use. We need to use responsible words, so don't make jokes with your patients during the consultation, because that will feel unprofessional. If the patient feel that you are unprofessional, how can a patient trust you? So that's from the practitioner side. From your words, from the words you use, from the language you use, you need to be nice and responsible. The third is we need to be careful not to not use colloquial language. So we do not use medical terms. We can use colloquial language. So colloquial language, which means that's the language we are using every day. Don't use the fancy words, especially in our medical dictionary. We got many fancy words, but do not use these words during the consultation, because not everyone will understand the medical terms. For the common medical terms, many people may understand, such as hypertension or diabetes. These medical terms have become quite common, so most of the patients may understand, but if you can try to avoid them. As for instance, for the other medical terms, such as the coronary artery disease, rather use heart disease or heart problem, though you can explain to the patient in more colloquial words, more layman words, because coronary artery with coronary artery, not everyone will understand. Or such as headache. If the patient feel headache, and then you ask the patient to feel sephalgia, the patient may be confused. What do you mean by the sephalgia? So use the common words that we use every day, especially the medical terms we use in Chinese medicine and acupuncture. For instance, some terms we already introduced, that's heart yang deficiency. If you ask the patient, do you feel heart yang deficiency? Do you feel liver fire? The patient will be confused. They won't be able to understand what you mean. So try to avoid use medical terms in the conversation. And also avoid any implications. In the inquiries, we do need to ask many questions. We do need to ask many answers from the patient, but do not provide any implications, because such as for some implications, it might be from the symptoms, or sometimes the patient will feel from your language or from your attitude. The patient will feel that if I say so, I may please the doctors better, and then the doctor can give a better prescription for me. So that's from the combination of your attitudes and your words can cause some implications. And also when you ask questions, do not ask some such as the questions in didn't you feel headache? Didn't you feel cold? So these kinds of questions will imply the patient that they should feel, I should feel the headache. So I should answer the doctor that I should feel the headache, because this answer will help the doctor better. That's exactly why the doctor will ask me, didn't I feel? So try not to use these kinds of questions. Rather use, do you feel any discomfort in your head? Or you can ask, do you feel fever or not? Do you sweat? For instance, for some patients, for your diagnostics, you might think that the patient may sweat at night. So in the inquiry of the symptoms, when we talk about sweating, you will see what does it mean by night sweat. So for a specific situation, when you think about the patient from the pattern, you can conclude to a pattern that the patient may have a nice sweat, but from the inquiry, you just want to confirm your diagnosis. Your diagnosis. So if you ask the patient, do you sweat? Do you sweat during the day or at night? Don't ask the patient, didn't you sweat at night? You rather give them different choices, and the patient from these choices, the patient will feel free and equally to choose any answers from there, such as do you sweat? And then the patient may answer yes or not. And when they say yes, you can ask, do you sweat during the day or at night? So for these kinds of questions, the patient can choose one from the other, and the patient won't feel any preference from the answer. So they can choose according to their manifestations, according to their feelings. So these are some of the cautionary notes in the inquiry. These skills we're going to practice again and again before you see the actual patients. The last cautionary notes, although we have mentioned that many aspects, you have to be careful when you inquire a patient. But for some situation, such as for emergency, for an emergency patient can, or in an emergency situation, if you saw some accidents on the road to the varsity, so you stop and you try to help the drivers or the passengers in the car accident. But in the meantime, you study very well from us, and then you realize that Doctor Who said that during the inquiry, I should have a quiet, undisturbed consultation environment. But on the highway, I don't have this environment. Also, I need to avoid any implications. I need to think about what language, what words I should use to talk to the patient. You see, for these kinds of emergency situation, don't care about all these aspects. You need to take the measurements immediately for the emergency, especially for patients with life-threatening conditions. You need to save the patient first and then discuss and then talk. Okay, so these are some of the tips for the inquiry, but don't stick to the tips one by one to another. These just give you some general idea as to how can benefit your consultation. How can you build a better relationship with the patients? Then you can attain more information from the patient and true information from the patient. So these are some tips. You can adjust them flexibly So from this video, we have gave you some general introduction on the inquiry, why we need to inquire the patient, and what's the questionnaire tips that we need to think about, we need to consider during during a consultation. For the next video, we are going to talk about the contents of the inquiry. Thank you, guys.